Hello, ADBC Jones. My name is Kendall. I'll be a practitioner today. I'm just gonna start by washing my hands. And what I want to do while I wash my hands, I'm just gonna let you know that I want to do a cardiovascular assessment, okay?
Okay.
So I'm gonna check your pulsations, I'm gonna listen to your heart sounds, and I'm just let you know if it's normal or not, okay?
Okay.
Now that I finished washing my hands, I'm gonna start by just laying you back in bed, put you in at 30 degrees. I also just want you to tilt your head up, but also to your left, please, so I can just get a view of your neck.
Okay.
You have very nice braids, I just need to move it out the way. And I can see your jugular venous pulsations. Very good. What I want to do is just measure the highest point of pulsation by placing this ruler on the sternal notch and aligning the highest point of the pulsation with the ruler. And I'm getting about 5.5 centimeters altogether. I know 7 centimeters and lower means it's normal, okay? I'm gonna start by, now I'm gonna just distinguish the carotid from the jugular venous pulsations. And I can see the difference. I'm gonna palpate it now. I'm gonna take 2 fingers, I'm gonna touch the medial aspect of the sternomastoid, this muscle right here. I'm gonna go a little medial. Okay, very good. And I can feel your pulsations. They're strong and brisk. Very good. I'm gonna check it bilaterally. Same. Now I'm gonna check your brachial pulses. Okay. Check them bilaterally, and they're also strong and brisk. What I want to do now is take a look at your apical pulse. Okay, that's going to be in your your fourth and fifth intercostal space, and I can see it in little pulsations. I'm going to palpate it now. Okay. Okay, feels good. That's not good. No heaves or lifts noted, and pulsations are small, brisk, and tapping. Very good. What I want to do now is just assess around your heart, okay? So you have 4 different sites I'm going to check, which would be your aortic site or aortic area, your pulmonic area, your tricuspid area, and your mitral area. So the aortic area is to the right of your sternum, and is the second intercostal space, so that'll be right here. Your pulmonic area is also in the second intercostal space, but it's to the left of your sternum, that'll be right here. Your tricuspid area is closer to your sternum and is about your 4th or 5th intercostal space. And your mitral area is right under the nipple line and also in 4th or 5th intercostal space. Alright, so as I'm assessing these sites, I'm checking for any heaves or lifts, none noted. I'm going to take the ball of my hand and place them in these same areas on your chest. And I'm checking for any thrills. And no thrills noted, okay? I want to take the point of my finger, I'm going to put it in your epigastric area. That's going to be right here. I'm going to press slightly under your rib, pointing towards your left shoulder. Alright? I want to just check for pulsations. When I do this, I just want you to take a deep breath and hold it for a second. Go ahead. Okay. Thank you. And pulsations are normal. I'm going to also check the 3rd, 4th, and 5th space in the border. I'm going to check pulsations also. When I do that, I want you to just breathe out and hold it for a second. Very good. And pulsations are also normal systolic, okay? We're going to move on. I want to auscultate these same areas, okay?
Okay.
So I'm going to listen to it with my stethoscope.
Okay.
Thank you. I'm going to start by using the, sorry, I can't hear myself. I'm going to start by using the diaphragm, the wider side of my stethoscope. And I'm going to listen to the 4 areas that I told you about earlier, okay?
Okay.
Okay, good. So you have normal S1, S2 sounds, no atrial or mitral regurgitation, all right? And no regurgitation, I'm sorry. I'm gonna check with the ball now, the bell. the bell of my stethoscope, and I'm listening to the same 4 sounds, same 4 areas.
Okay.
Okay. So no S3 or S4 sounds and no mitral stenosis noted. Okay, so it was really good. You had a really good assessment today.
Thank you.
Any questions for me?
No questions. Thank you.
Thank you very much.